Hi, my name is Milt Bedingfield. I'm a certified diabetes educator and exercise physiologist. I've been teaching in the field of diabetes about 17 years. One of the things I want to share with you today is a question I get frequently is, will I ever get rid of my diabetes? Can I cure it? And many patients are surprised to find that you cannot cure type 2 diabetes. You cannot cure type 1 diabetes. In rare cases, there's things you can do for type 1 diabetes that might make it disappear, but that usually requires surgery or something of this sort. The type 2 diabetes, you can successfully treat your type 2 diabetes, but you can never get rid of it. The reason you can't get rid of it is what I'm going to explain right about now. First of all, this is your pancreas. And your pancreas is an organ located behind your stomach that makes insulin. Actually, the pancreas doesn't make insulin, but these little beta cells make insulin. I like to think of them as insulin-producing factories. And if this is a blood vessel, when you eat, sugar gets into your blood. As sugar starts into your blood from your stomach, that causes your beta cells to wake up and start making insulin. The insulin that's made in the beta cells is then dumped in the blood, grabs a hold of a sugar, and takes it to other cells throughout your body. That's basically the way it's supposed to work. The insulin is a lot like the UPS guy. The UPS guy delivers packages. In this case, the insulin delivers sugar, picks it up in the bloodstream, and delivers it to various cells throughout the body. Now, in the case of type 2 diabetes, when the doctor first says your blood sugars are climbing above normal, it's estimated that half of these beta cells that make the insulin have quit working. With half your beta cells not working, let's just go ahead and get rid of them. With half your beta cells not working, you can't make enough insulin to pick up the right amount of sugar to get it into your cells. Maybe you can make enough insulin to get this sugar out of your blood and into your cell, and this sugar out of your blood, and this sugar out of your blood, but you cannot make enough insulin to get the right amount of sugar out of your blood and into your cells. Now, the question that comes up is, well, can't you get new beta cells? And the answer is no. When you go home tonight and take a shower, you can scrub under the with a washcloth, stand under the shower head, and dirt and dead skin cells will go down the drain. That's fine, because you got a whole bunch of brand new ones underneath. You grow new you grow new blood cells every day, but you can't grow new beta cells. You have a certain number when you're born, and once they're gone, they're gone. It's estimated when your blood sugar levels first climb above normal that half your beta cells have died or quit working. And again, with this many beta cells left, that's not enough beta cells to make enough insulin to get the right amount of sugar out of the blood and into the cell. Therefore, your blood sugar levels are elevated. And we cannot grow new beta cells. That's why we can't cure type 2 diabetes. You can very successfully control it and keep your blood sugars where they need to be, but you can't get rid of it. And controlling it is pretty much just as good as getting rid of it. But in order to control it, you need to lose some weight frequently, because many people with type 2 diabetes are overweight or particularly over fat. They need to eat less carbohydrates or sugar, and they need to get plenty of exercise. Now, if they're able to do all these things, their body will require less insulin to get the sugar out of the blood and into the cells. It may be that even with this many beta cells left, only half of what you're supposed to have, it may be that even with only half of them left, that may be enough to get the sugar out of your blood and into your cells if you weigh less, get plenty of exercise, and reduce your number of carbohydrates. Because these, in a sense, are working more efficiently. We know that high levels of fat in the body make it much more difficult for the insulin to do its job, which is to get sugar out of the blood and into the cells. So as long as you're careful, you're doing the things you need to do, like keeping your weight down or losing weight if necessary, watching your carbohydrate intake, and getting plenty of exercise, there's a good reason to believe that your blood sugar levels will become much more normalized. Maybe just as well as somebody that doesn't have diabetes. But as soon as you get careless and gain some weight or eat the wrong kind of food, stop getting your exercise, your blood sugar levels will climb right back up again. And you may say, oh, my diabetes came back. It's been gone for a year. It was never gone for a year. You've always had your diabetes and you always will. You were just successfully controlling it, so whenever you checked your blood sugar, they appeared normal, but your diabetes never left. Okay? So, to summarize real quick, you do what you're supposed to do, you get your weight down, eat the way you're supposed to, or what's recommended by a dietitian or a diabetes educator, and get plenty of exercise. It could be that even with diabetes, type 2 diabetes, you can maintain normal blood sugar levels pretty much the same as someone that doesn't have diabetes.